minute, 1 minute.
We are live now, Mr. Dominique.
Mm-hmm. All right.
If
Hello,
you if
everyone.
you
I
want
think we are on live now.
yeah, Via, if you want to follow the webinar on Facebook, where do you have to click? If it's on the site, it starts immediately, or how is it going then?
Okay. You mean people who want to
Oh yeah, yeah, yeah.
rewatch the
I
video?
found it. I found it. It's okay.
Okay.
Yes, I
Okay.
Yes.
found it.
We will be
Yes,
saving that
okay.
video.
Yes,
Uh-huh.
okay. It's good, good.
I
Yeah,
think we're live now.
yeah,
Thank
yeah.
you very
We are
much to
right now. We
Dominique
can
for
start.
joining us.
Yes, we can start. Yeah.
Yes, thank you. Okay, for those who entered the live, uh, hello to everyone. Thank you for joining us. We're just giving just maybe a few minutes to allow more viewers to join us before we officially get started. Um, yeah. In the meantime, feel free to say hello in the chat and let us know where you're joining from. Let's just give 1 minute. I believe a lot of people would like to join us.
Mm, Sebastian.
Mm-hmm.
Christian.
All right. Okay, I think it should be okay now. Let me just see here. Then. Anyway, I think we can start. Hello again to everybody. And welcome to this special live session with Verita Neuro. We are thrilled to have you with us today for an engaging, inspiring, and educational discussion. And this session is a unique opportunity for you, for everyone, to hear directly from Dominique, and one of our remarkable patients here in Thailand. Dominique will share her personal journey with epidural stimulation treatment, and she will offer valuable insights with her experience and goals, as well as her progress. Yeah, joining us today as well, our medical director, Dr. Nasir Majid. He is our medical director, and he oversees our global medical and rehabilitation team. And he has a lot of, maybe a decade of expertise in neuromodulation and neurorehabilitation. And myself, my name is Vea. We will be diving into this session, exploring the potential of epidural stimulation. And feel free to write down your questions in the comments section. We will be very happy to answer all of those. um, but I think the first question will be for you, Dominic. um, please, how will you introduce yourself? Please feel free to introduce yourself to the viewers.
Okay. Thank you, Via, for the introduction. So I'm Dominique. I'm coming from Belgium. 1 year and 9 months ago, I had an accident at home. I fell
Mm,
from the stairs from the first floor downstairs in my home, and it were quite, I think, about 20 stairs. At first, I was unconscious. I think I was about 20 minutes unconscious. And when I woke up, I was lying on the floor and I couldn't move anymore. As
mm,
I am myself a nurse, I immediately knew that I was paralyzed.
mm,
There was nobody home. My husband was not home. So the only thing I could do was wait lying down there and wait for him to come home.
mm,
So I couldn't move my legs and I couldn't handle something with my hands. My mobile phone was next to me, but I couldn't take him because I couldn't move my hands. So
mm,
I immediately realized this was quite a big accident.
mm. All right. You have
Um,
shared a little bit about your condition with the hand function, but are there any other things, for example, you can share with us about your condition before you had the treatment?
yes, so I was. They put me in the emergency of the hospital, and they did immediately an operation, and they told me afterwards that I had broken my cervical vertebra C6 and C7, and that I had an incomplete spinal cord injury. So I was for 7 weeks in intensive care and in neurosurgery in the general hospital. And well, I was just lying down there in a bed. I couldn't do anything. The nurses there were taking care for me for everything, washing, clothing, giving food. So I couldn't do anything. Then after 7 weeks, I moved to a rehab center, and I stayed there for 11 months in the rehab center. And there I got, during 3 hours a day, 1 hour and a half in the morning and 1 hour in the afternoon, I got intensive rehabilitation exercises.
Mm-hmm. Right. Well, with regards to the treatment that at least at the rehabilitation, and looks like you are someone who is very proactive in looking ways or finding ways for your recovery. How did you find out about epidural stimulation at Verita Neuro?
So when I was in the rehab center and I realized that my spinal cord injury was quite severe, as I never give up in life, I immediately start to search myself on the internet, and I just was on Google, and I made this only sentence: where in the world can people with spinal cord injury have help to heal or to cure the spinal cord injury? So I made this sentence in Google, and then I immediately got the link for Verita Neuro. So I found your hospital and your treatment, and I started to read. I did it in
Mm-hmm.
the first 4 months that I was in the rehab center.
Oh, first to 4 months. Yeah. Can you tell us a little bit of insight of what treatment did you receive with Verita Neuro?
With Verita Neuro, I
Yes.
received,
Mm-hmm.
they gave me a stimulator, a neurostimulator from Medtronics, and it was with a small operation, and they give me stem cells. And afterwards, it's a very individual program because they are going to do the mapping, which means that on individual measurements, they are going to set the programs for the neurostimulator that you can do more movements with your legs.
Mm. Yes. So Dominique, yes, you received epidural stimulation, that is lumbar for lower limbs, and of course regenerative treatment and a lot of physical therapy. Dr. Nasir, I do want to inject one question. As Dominique mentioned that she has C-level injury. Um, can you give an insight as well? Why did we give a um, lumbar stimulator, or why did we provide this protocol for him and for her?
Yeah. So Miss Dominique, she sustained a C6 over C7 compression fracture, which caused the anterior displacement of C7 vertebra, which means the C7 vertebral body moved towards the spinal cord and it caused compression over the spinal cord. So this is called a lower cervical spinal cord injury. In many patients with this level of injury, very luckily, they have quite a significant amount of spared upper body functions. So when we made an assessment for Miss Dominique, we found that her upper body function was in reasonable condition. She had finger function, she had wrist function, she had bicep tricep function. So we decided that it was not necessary for her to receive the cervical stimulator, and only the
Mm,
lumbar stimulation was sufficient, because we concluded that her upper body function was good enough
mm,
to support her lower body during the walking training or standing training. So that was the primary reason that we decided it was not necessary for her to receive the cervical stimulator. In
mhm,
many other patients with, unfortunately, those with more um, upper level of injuries like C5, C4, they have further loss of upper body function. They have significant loss of hand functions. For those patients, it might be necessary to receive the cervical stimulation, but it was not the case for Miss Dominique.
mm. Right, right. Um, Going back, Dominic, to your injury, as I remember, you sustained the injury, I think, early last year, which is 1 year and 10 months ago. Before, deciding for the treatments or before arriving to Thailand for the treatment, what are your expectations prior to that?
Well, before I came to Thailand, I got a
Mhm,
very, very good rehabilitation in the center where I was. And the thing is that the physiotherapists there, I really must also honor them because they were quite busy with me to give me the best as possible rehabilitation. And in those 11 months, and also when I came home and I had a personal physiotherapist at home, they maintained my muscles. So my muscles never diminished, and they were weak, but they had just they kept the right consistent the muscles. So this was very good, but I experienced that it won't get better. It stayed all
mm,
the time on the same level. I didn't go any more backwards, but neither forwards. So and then the doctor, in the end, when he wrote me the medical report when I was leaving the rehab center, he said,
mhm,
"Can I put on the report that you will always stay like that?" And I only could say, "Yes, you can write." But in my mind, I
mhm,
said, "No, I'm not going to stay like that. I'm going to Thailand." Before, in beginning, I didn't say to anybody, but in my mind, that it was already said. I going to Thailand and I'm going to fight. I'm going to surrender. I want to go forward.
mm,
So
mm,
this is the big difference when I came here, and after the treatment, after already 4 weeks treatment, I feel that I have to work, and I do also the work like I did before in Belgium. But now I can have goals. I have a foresight, and I feel that I'm going forward. This is the big difference. I have
mhm,
progress. I feel the progress with all the work that I do. I did the same work in Belgium before the treatment, but now after the treatment, I really feel progress. That's the difference.
mhm, mhm. Right. It is actually very good, that you have been doing all these things, right? Dr. Nasser, w- I do have some question with regards, for example, for the timing, and as we know, Dominique's injury is not very old. Can you tell us how soon can patient actually to proceed with the epidural stimulation, and how important is the timing of treatment?
Right. In terms of the onset of treatment, there is um, no limit how early can we start. Um, we can start as soon as patient is stabilized, because many patients with spinal cord injuries, they sustain multiple injuries. They have what is called polytrauma generally. They have multiple fractures, so they have to be stabilized. Many patients, they get spinal fixations. Some of them are on ventilator, so they have to uh, improve their
Mm-hmm.
respiration. So it
Mm,
generally takes 3 to 4 months for many patients to become stable enough to travel, and I think that's the time period
mm,
those patients can travel. Um, so generally speaking, as soon as they can travel, we can start the
mm,
treatment. Um, and For Miss Dominique, uh, her injury was early 2023, and she
mhm,
traveled um, last month. So we are still during an early stage, because we believe
mm,
for first 2 years there is maximum potential for recovery, especially after stem cell treatment, because stem cells, they basically work with the scar tissue. They reduce the scar tissue. So if we can, um, because scar tissue in the spinal cord is a bigger problem, so with the stem cell treatment we can interfere in the scar tissue formation. So this is how stem cell treatment can play a part. And I believe that's one of the reasons Ms. Dominique is also able to report better recovery,
mhm,
because it's still considered an early phase of her injury.
mm. All right. Thank you, doctor. Dominic, could you please talk us through the medical evaluation and the consultation, the initial consultation with Dr. Nasir?
Yes, when I still was in the rehab center, so I did an apply. I sent you a message that I wanted to talk to the doctor, and then after setting the right date and hour, I got the contact with the doctor, and I
Mm,
sent you the MRI, and the doctor was seeing to my MRI. And then while we were talking, he said that I was okay for to come to Thailand and to do the operation. My only concern, and this was also the concern of my family, that and friends, it was my age. I am already 64, and
mhm,
everybody said, well, aren't you not too old for this? And but as as I set up my mind that would do it, so also Dr. Nasir, he said to me, no, no, your age is no problem. You can still come to Thailand. So I it was a good consultation. I was very glad with it.
mhm. Yes. With regards to consultation, Dr. Nasir, what information do you need from the patient for us to evaluate, and like what are deciding factors? Mm-hmm.
Right, we put a lot of focus on um, pre pre-arrival, pre-treatment assessments. We want to make sure um, patients fully understand their condition, they are aware of all the options, and they are able to make an educated decision. So we request some some necessary information about their condition, which includes some basic information about their clinical symptoms, their medical history, and also the important factor is a spinal MRI scan. By far, spinal MRI scan is the best method for us to see the nature of the injury, the impact, the location of the injury, and make an educated decision as to what's the best treatment option for them. Um,
Mm-hmm.
and also, Mr. Dominic mentioned about the age. Age is also
Mm-hmm.
sometimes it's a factor, of course. But Miss Dominic she was in excellent health, apart from, of course, her injury. So that was not a big factor. So that was, of course, I think a major reason that she decided to go for the treatment, because her cardiovascular function, her overall body was and is in excellent condition.
Right. So yeah, with this, well, after the consultation, Dominique has qualified for epidural stimulation, and um, with regards to the decision making process, what was the deciding factor, Dominique, that you told yourself that epidural stimulation is for you, and you do whatever it takes.
Yes, indeed.
Mm-hmm.
So I first I had to come home from the rehab center. This was the first stage. Then, once I came home, I had to solve a few practical problems, and I had to take my measurements to come to Thailand. But it all went fine. And once I was here, it all went very fluently.
Mm-hmm. Yes, good to know. And so you decided you come, you arrived to Thailand. You had the surgery. How soon after the surgery did you actually start to see the changes, and what are those? If you can explain, if you can share with us.
Well, I came on Wednesday, and on Thursday I had immediately the surgery, but they put only the neurostimulator on the Monday after the surgery. So 4 days after the surgery, and in that week I still got the stem cells injected during the whole week. So it
Mm-hmm.
started to, I felt to have the the beginning of the progress. I start to feel, let's say, 9, 10 days after starting up the neurostimulator, and after I got the stem cells, about 8 to 9 days after it started.
It's nice.
Yes.
Mm-hmm. And I think, in addition to epidural stimulation, and the stem cells, you also did the mapping, right? So how was the mapping process for you, and how did you find the experience?
Well, the mapping process, I
Mhm.
didn't quite good understand what it all meant before I
Mm,
came, but now I fully understand. The mapping is very, very individual. It's on measure of each person different. So the mapping, I think Dr. Nasir is better in explaining how it really
mhm,
works. But for me, I can say they are measuring the power which you still have on your own, and the
mhm,
power they have to add to make you more make the movement. So for example, for me, I had still quite power left in my left leg, but not at
mhm,
all in my right leg. So they make more power in my right leg, and my left leg is more going naturally, like before. So this is a bit like mapping for me. But
mhm.
I think that no, Dr. Nasir can better explain how it
Yes.
really works.
Yeah, yes, Miss Dominic, this is a one way to put. So mapping is basically quite it's quite individualized, as Miss Dominic said. So basically, after any kind of trauma to the spinal cord, generally speaking, apart from very few individuals, some structure is spared in most of the cases, even though many patients they have what is called complete functional injury, which means they don't have any functions left below the level of injury. from the structural point of view, the structure of the spinal cord is still there, but not functional. So normally there are some pathways, motor pathways, which are still able to go through the injured spinal cord and able to communicate with the lumbar spinal cord and with the legs ultimately. So during the mapping process, basically we try to recognize what pathways are still there and what pathways are missing, what is the level of stimulation we need to optimize the remaining pathways. So it's basically this is by definition, neuromodulation is the optimization of the existing pathways. So we try to optimize the existing motor pathways to compensate for the loss of other fibers which were injured during the surgery. So during the mapping process, we basically provide precise electrical stimulation to the legs and able to the muscles are able to contract, and then we become more and more specific to convert this into more volitional muscle function, and so the movements slowly come back with mapping, with programming, as the spinal cord and legs are being stimulated more and more precisely.
Mm-hmm. Doctor, we do have one question actually from one of the viewers from Nina Shehan. With regards to mapping, this person asked, what are the positive results and outcomes after the mapping at maybe what we saw from Dominique at this point? What movements and feeling have improved?
I think maybe Ms. Dominique can explain about. Is it a generic question? I'm not sure, or it is specific to Ms. Dominique. Maybe I think maybe Ms. Dominique can talk about her condition, and then I will talk more in general terms.
In general.
Okay. What the improvement I got after these 4 weeks now, because it's 4 weeks after surgery, are the following. I have, first of all, I have my blood pressure, my hypotension is gone. So this is for me the biggest improvement, because before I came, I couldn't stand upright for more than 5 minutes. I had a very low blood pressure. It went, and when they put me upright on a tilt table or on a standing table, it just lasted for 5 minutes, and I had to go and sit down again. It was hopeless before I came. So after 4 weeks, they started up, and in the beginning, I stand up for 5 minutes, then for 10, then for 30 minutes, and now I can stand up every day for 1 hour, even more if I want. But we are doing 1 hour, and it goes perfectly. I can even during standing up, I can play games, I can talk, I can see on my mobile phone, I can do anything. So this is enormous good for me, because this was really very bad. Secondly, my temperature. I was all the time very cold. I had to cover myself with jackets and fleece and pullovers, and that's completely gone. I have no cold anymore, so my temperature is much, much better. Third of all, I'm much less tired. Before that, I woke up at 8 o'clock in the morning, and at 10 o'clock I slept already again. So for 1 hour, and in the afternoon I had to sleep. And now this is also very good now. I'm much less tired than before. My bowel function is much, much better. That improved also. And then concerning the motion, the most spectacular, after 4 weeks, I can lift my right ankle. So I could already, before surgery, I could lift my left ankle. As I said, that my left leg was much better than but there was no motion at all in my right ankle. And now I can lift my right ankle. And last
Mhm.
but not least, since last week, I can uh, stand up between two parallel bars, and I can lock my knees and
Mhm.
so stand up with a hoist. They are helping with the hoist, but when I stand up now today, I was about carrying 50 to 60% of the weight of myself already. So this was
Mhm.
also already a big progress, a big
Achievement.
improvement. Yes, because
Mhm.
before I never could bury my own
Mhm.
weight. I couldn't not stand up between parallel bars, even not with a hoist. So
Mm.
this is really an improvement. And
Mhm.
I feel if I do enough exercise, that I still
Mhm.
can improve more and more and more.
Mhm. Yes. I actually spoke to one of your therapists. I think he mentioned that you can move your ankle even if the stimulator is off. I think that's what was mentioned. Dr. Nasir, what about on medical point of view? What is the mapping process?
Yeah. So for Miss Dominique, yes.
Mm-hmm.
Uh, so we we are doing around 4 hours of mapping every day for Miss Dominique. It's a I think it's quite important, like Miss Dominique mentioned, that during the mapping we discover what are the spirit pathways and how do we compensate for the other pathways using the external electrical stimulation. Um, Regarding Miss Dominique's recovery, yeah, I think we made a good progress. It's
Mm-hmm.
just 4 weeks since the she received the treatment. So in four weeks, I think we made great progress. Blood pressure regulation is an often overlooked aspect of the recovery in spinal cord injury
Mm-hmm.
patients, but this is one of the most important factors, right? If you always go through postural hypotension, you suffer from like dysreflexia, autonomic dysfunction, you really can't do much. So I think this is a great improvement in Miss Dominique's case, that essentially her postural hypotension was treated. Um, and this was not unexpected also, because we expect the stimulation to somewhat increase the autonomic functions basically. So one of the good additional benefits of the epidural stimulation is increase what is called sympathetic activation. So the lower thoracic spinal cord, which is located very close to the site of implantation, gives a lot of nerve supply to our GI tract. And so this is a very big pull um, of our blood circulation. So once we stimulate the lower thoracic spinal cord, we also see optimization, regulation of autonomic function, and blood pressure regulation. Same for body temperature regulation and um, autonomic parts of bladder and bowel function. So yeah, I think we are seeing quite a remarkable recovery for Ms. Dominique in all aspects of her
Mm-hmm.
treatment. Yes, and I also saw she's regaining some motor function even in the absence of the stimulation. So that's
Mm-hmm.
this also indicates that it's there is some ongoing regenerative process in the spinal cord. So this can be attributed partly to stimulation, but mostly to stem cell treatment. So stem cell treatment does produce more functional tissue in the spinal cord. So this is the
Mm-hmm.
plausible explanation for her being able to produce some movements without the stimulation.
Mm-hmm. Right. It's good to hear, these achievements. Before we proceed, if you don't mind, Dr. Nasir and Dominique, we just have few messages. Um, Manuel says, hola. Sebastian says, hi. Jap, boss, Alex, hello. We are also have a viewer from Croatia. Hello, Carlo. And Charlie Allen, I think Charlie. Dominic. She said, my brave and beautiful friend, Dominic. So I think Charlie is saying hi to you. We do have one question here, asking about, let me see, this question came twice already, Dr. Nasir. Can the procedure help a spinal cord injury if the diagnosis is complete?
Yeah, so if it's complete injury, uh, actually, a great majority of our patients are actually with complete injury, which means they
Mm-hmm.
have what is called Asia A score. So they don't have any sensory function, any motor function. So essentially, it's a complete injury. So the stimulation can help patients with complete injury.
Mm. Well, we talk about the timing of injury. I think there are also a couple of questions about this. Can someone? This is from Jamel Jamal. Can someone after 20 years can make still progress?
Yeah. So the the epidural stimulation can be performed in patients with older injuries. Actually, we treated a patient with 32 years old injury. The
Mm-hmm.
recovery was slightly slower, uh, but it was
Mm.
expected because it takes more time to activate the muscles. But the treatment can be performed in patients with
Mm.
older injuries.
Mm-hmm. Okay, thank you, doctor. Going back to the interview, Dominic, in addition to the epidural stimulation, I think you mentioned as well about the stem cell treatment. How was the stem cell treatment, and what did you know about it before going to Verita Neuro?
Well, about stem cells, I didn't know not much about this theory. Sorry, but
Mm-hmm.
I got the stem cells, and I just can say this treatment it's not painful at all. Um, Normally, I'm all the time very anxious to needles, and although I am a nurse myself, but for myself, needles it's not done.
Mm.
So, but anyway, I can be very sure about this. It's not painful. I got, first of all, a load of stem cells during intravenous catheter. And then I had twice intra an injection
It's
in my spinal cord, immediately my back, but it's not painful. So, and when I started to read a bit and to learn about, I really am sure that these stem cells are going to help me, and that they are going to heal a little bit, like the doctor said, the scar tissue in my
mm-hmm.
spinal cord.
Mm-hmm.
I really think this will help me too. I think that the whole treatment is very based on the combination of stem cells and mapping and neurostimulator, for me. I speak for myself.
Mm-hmm.
Yeah.
Yes. Dr. Nasir, with regards to stem cell treatment, we have been receiving a lot of questions about the safety that, I'm scared to do stem cells because of this, because of that. Can you tell us how safe at least the stem cells that we are offering at Verita Neuro?
Yeah, there are no like life-threatening or long-term complications. We actually never observed anything which is life-threatening or permanent.
Mm-hmm.
And we performed essentially thousands of procedures with stem cell
Mm-hmm.
treatment also, because we also treat people with other injuries like brain injuries, stroke,
Mm.
um, different kind of neurodegenerative progressive autoimmune conditions. So yeah, it's quite safe. Honestly, there is
Mm-hmm.
nothing to worry. There are some minor things like sometimes headache or fever, but these are really related to the procedure itself, not from the stem cell treatment. No risk of rejection, no risk of tumor.
Mm-hmm. Thank you, doctor. Dominic, we are reaching towards almost the end or the week of your treatment. As maybe viewers do not know, the treatment is actually a bit over a month of treatment with us here in Thailand or in other facilities. With those 35 days, what did you like most about your stay here with us at Verita Neuro?
Well, this is difficult to say. I regret already to go back. on Tuesday. I wish I could stay a bit longer still, because everything, I must say,
Mm-hmm.
the first, I stayed the first 2 weeks in the first 14 days in hospital. Everybody is so professional, very professional. The you see you There are doctors coming. I saw Dr. Nasir, but I saw also a doctor for internal diseases. I saw the
Mm-hmm.
neurosurgeon, I saw the
Mm-hmm.
anesthetist, and they are all so professional. The hospital is high standard, uh, very clean, very professional. I can't say anything about it. Nurses are very well, also educated, professional, all the time, very concerned about you, very friendly, very nice, really. And then when the process begins with your team, with the physiotherapist, they are they do so much for me. They did so much for me. Um, they are working all the time with you. They are inspiring you. They are um, making that you feel all the time happy, and that your mindset is positive. They are themselves all the time positive. So no, it was a
Mm-hmm.
very nice, very nice.
Mm-hmm. Thank you for. I'm very happy to hear that you have enjoyed your stay with us. And after here in Thailand, you're going back to Belgium. What are your long term goals for this treatment?
My goals in Belgium is that I got now all the tools. Oh, I have to exercise, so I can also myself exercise at home. I have just to buy small things like some weights and a ball. Uh, Luckily, I have already a standing up wheelchair, so I can stand up every day. As I'm now so less tired, when I am washed and clothed, I can stand up immediately for 1 hour. I can do some exercises with my arms, with my legs, with myself at home. And I hope that I can come back to my rehab center to do more exercises for standing up between parallel bars with a hoist, with a walking frame. I hope I can start up again there and have again a good rehab. My goal for the next for the next 6 to 7 months is that I can stand up myself with a walking frame, so that I just already can stand up, and that I maybe can make a transfer from the bed to my wheelchair, or from my wheelchair to the bed again. So this is
Mm-hmm.
already my goal for the next 6 7 months, and
Mm-hmm.
then we will see further.
Mm-hmm.
um,
Yes. Yeah, Dr. Nasir, from the medical point of view, what could Dominique potentially achieve in the future if she continues to do rehabilitation?
Yeah. So well, we set few goals.
Mm-hmm.
One is, I think, if we have to break down. So we have some programs for individual strength training. So when she's on wheelchair, she's able to perform some movements which can strengthen her muscles. She also has some trunk program for like sitting balance improvements, some improvements in paraspinal muscles. Then we have some exercises for standing position where she's able to stand. Like she said, she can lock her knees and stand. And then we
Mm-hmm.
have, of course, the ultimate goal will be to 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 train individual muscles going forward, and also to regain enough strength and control in the lower limbs to be actually able to walk with support like a walker. So that's our goal from the treatment, and I have no doubt. I think we will
Mm-hmm.
reach there. It's of course it's matter of
Mm-hmm.
time. It's it will still need some time, but looking at
Mm-hmm.
the trajectory, I'm very confident
Mm-hmm.
about achieving those goals from Dominique.
Mm-hmm. Yes, I think so. That especially Dominic seems like a person who is committed to doing all this rehabilitation. We do have a few more questions, Doctor. From J Moore 74. Does it help with burning nerve pain?
It's not the primary treatment. I mean, the stimulator itself is also used for neuropathic pain. That is actually its main application. But for if we want to treat the nerve pain, we have to implant the stimulator at a different location, and it has to program in a
Mm-hmm.
different way. So this is not our
Mm-hmm.
intended use. Our intentions are to generate the missing motor response. So we focus on the
Mm-hmm.
movements with the stimulation. So it's difficult to really say if it can help in everyone. We have seen some patients where their neuropathic pain levels improved after the stimulation, but those patients, they also received stem cell treatment. So we believe stem cell treatment played an important role. So this combination can help, but I think it's difficult to say that it would definitely help. So because it's not
Mm-hmm.
its primary application in this case. So stem cell treatment has, I think, higher potential to improve pain levels.
Mm-hmm. Dr. Nasir, also from Mr. Stewart is back. Doctor, do you ever had a patient who had bullet in the spine, and can the procedure help with the improvement?
Yes, so we do have some patients with gunshot injuries. They sometimes the bullet is in like in a difficult location where it's riskier to remove the bullet because sometimes it can cause more damage. So sometimes the doctors, they don't perform the removal surgery. They keep the bullet in the body. So I think we have to really see the CT scan in this case to see if the bullet is occupying what is called spinal canal, right? If it is like if there is complete occupation of the spinal canal with the bullet, is there is maybe very little spare tissue. I think it would
Mm-hmm.
be difficult, um, but in case the bullet is not in the like really middle of the spinal canal, and
Mm-hmm.
it's not like occupying the spinal canal, then it's not a problem. So I would say a CT scan would be very helpful to see specifically, but
Mm-hmm.
I think there is very likely that such patients can qualify for the
Mm-hmm.
stimulation. I would encourage them to maybe just send a CT scan. I think that would be really
Mm-hmm.
a
That's
best
the
and
best.
quickest way to know.
Mm-hmm. Yes. Actually, one person also asked from IG how to speak to you, doctor. For those who are very interested to, have the medical evaluation, speak to the doctor for the consultation. You can uh, go to our bio on Instagram, speak to the patient services. There will be a form there you can send. And of course, once we receive your questions, we will reach out to you as soon as we can. Doctor, with regards to the components of the device, there's one question from Edith Frank Winters. How many years can the stimulator stay in the body?
Yes, so stimulator has two components. One is the electrode plate, which is called pedal electrode. So this is the electrode plate which goes into the spinal canal. So this is like non-electronic component. Then we have what is called IPG, the pulse generator, which is actually the stimulator. So this comes with a rechargeable battery, and it has life expectancy of about 9 years. So one implantation can stay in the body for up to 9 years, but after 9 years, the battery may expire and it has to be replaced with a new unit. But the central component in the spine can stay permanently.
Mm-mm. All right. Going back to Dominique, I think we have questions. We will answer as much as possible. Dominique, let me quickly check over here. Uh-huh. You were a nurse before and you took care as well. For everybody who doesn't know, Dominic is actually a nurse. You took care of spinal cord injury patient before. What was how do you find the treatment and the care at Verita Neuro with regards to, how you did it or.
Well, What's the question?
Like
I don't understand.
how how do you find the treatment and care at Verita Neuro?
Oh, it's
I think she's
like I
asking
said,
from like from nursing point of view.
Mm-hmm.
from nursing point of view, it's wonderful. It's just wonderful. There are so many people here taking care for me. Everybody is taking care. There are a lot of people, and it's so good organized. I From my point of view of being a nurse, it's perfect. It's just perfect.
Mm-hmm.
It couldn't be better.
Mm. So we do have 10 minutes in this live video. If you have question, please, for the viewers, write down. We answer as much as possible. I think the live will go once we hit 1 hour, but we will try our best to answer those. I think as the last question for you, Dominic, um, you've come a long way. What message do you have for people who are waiting to learn about your recovery? And what advice could you give to someone who also have the same situation?
Well, for me, I think the most important, and I did it for myself, and I did it also before for the patients I was taking care of when I was myself a rehab nurse. Stay
Mm-hmm.
positive. Stay positive in your mind all the time. In your mind, I never let myself being depressed or down. I stayed positive, and I said I will do everything what's in my strength to go forward and to make progress. And you do it, first of all, for yourself. And I do it also for my partner, for my husband, for my family, my son, and especially for my grandchildren. I also want to get better. And I said it from the first day that I was injured. I will come as far as possible, and I will do all my best for it. So, I think if you have a strong and positive mindset, you can do much more. You can do much. And I think also, well, of course, it's not possible for everybody. Not everybody has the same strong and positive mindset like I have. But anyway, try to do that. My goal now is, before I was injured myself, I was rehab nurse, and I was inspiring as many patients as I could to get better, to go forward. To I pushed them. I found
Mm-hmm.
remedies for them, and now that I'm myself injured, I want to be an inspiration for all other peoples to go forward, to push themselves. Yes, I really want to do that. I really want to inspire the people around to go and to have a positive mindset.
Mm-hmm. Thank you very much for those inspiring words, Dominic. I believe this video, in addition, I mean, for those viewers right now, they are inspired. It's very helpful. Your experiences, you're sharing with them. This live will be recorded, I mean saved for other people who wants to join as well. So just keep an eye maybe on Instagram or Facebook or YouTube. Actually, we do have one person from YouTube asking about WhatsApp number. So I think the best way for you to reach out to us is maybe you can head to our website, epiduralstimulationnow.com. There is an inquiry form, and on Facebook as well. You can send us a message on our inbox. Let's see if we missed some of the questions. So Dominic, she's from Belgium. There's actually one interesting question from Mr. Stewart is back. About the English barrier do in Thailand, and how do we assist with that? Well, correct. We are located in Thailand, and we do have a lot of international patients, Dominic as well, from different parts of the world. So the good thing is we have a diverse team. We do have a Thai speaker, of course, English speaker, Polish speaker, French, Spanish, Hindi, and of course, I myself speak Tagalog. But other than that, French, we do have a French speaker, Arabic speaker as well. So, if you could tell us where you're from, we'll try our best. But currently, with this, we're in this generation. A lot of our people bringing their live translator. We do a lot of Google Translate as well, so our technology is quite advanced, but we highly recommend that you come with a carer who can speak English, and I think that will be the best way to have a good communication between the team and yourself. Uh-huh. Anything else? um I think that's it. uh do we have some follow-up questions? Any messages, doctor? Well,
Yeah.
I'll my due diligence checking some stuff. Hmm.
I just want to say something. before
Sure.
I
Yes.
came, before I came, and this was helping me as well. I read a lot on your website, and I was reading a lot of reviews of all the patients, and I looked at all the
Mm.
webinars, and this helped me also to make the decision to come. So try to read because as I said before, it's different for each spinal cord injury patient. It's also different. And I was reading all the reviews from a lot of patients who were already on your website, and this helped me also to make the decision.
Right. So correct. What we are also offering is for you to be educated, to have an options for you for during the consultation. We explain everything, and it's still from the for the patient to decide. We want patients to be comfortable with the steps that they're taking. So yes, get as much information as needed, and if you need any information from us directly, of course, you can reach out to us um on our socials, on our website. Anything follow up? Let's I hear heard some. So there is a question about insurance application process. So standard insurances do not cover the treatment, as the treatment is FDA approved for trials, but it's not FDA approved yet. Please, we can explain further about the other process. So we can explain to you how we can possibly help, but majority, i- a patient pay for them for the treatment, and yeah, for standard insurances, they do not cover. But if you do, can check with your insurance provider. So if there is some documentation needed from our side, of course, we are very happy to help. Uh, what else? So there's 2 minutes left, but I think that's it for now. We do have a follow-up greeting from Sebastian Dur. I think you know Sebastian. Dominic. Great to see you,
Yes, yes,
Dominic.
yes,
Seeing you
yes,
back in
yes.
Belgium next week. Yes. All right. Thank you so much for joining us today, everyone, and Dr. Nasir, Dominic, for being part of this insightful session. For the viewers, we hope you found it both informative and inspiring. Thank you, Dominic, for sharing your incredible insights, and Dr. Nasir for your expertise.
Thank
So,
you very
as I
much.
mentioned,
Thank you, Mr. Dominique.
yeah, if you have any, thank you, Dr. Nasir.
Bye.
So,
Thank you. Bye.
yeah, I think that's it for us now.
Yes,